experts raise alarm over hasty prescription of ADHD meds to preschoolers. In a shocking revelation, specialists are warning that medications for attention deficit hyperactivity disorder, ADHD, are being dispensed too hastily to young children in the United States. This critical issue is gaining traction as millions of American kids are diagnosed with this lifelong neurodevelopmental disorder, which is among the most prevalent in childhood. ADHD impacts the brain, causing difficulties in concentration, controlling impulsive actions, and excessive activity in children. Doctors advocate for a 6-month period of behavioral therapy before considering medication for kids aged 3 to 5. However, Stanford Medicine researchers have flagged concerns that these guidelines, endorsed by the American Academy of Pediatrics, are frequently ignored. Young children are often put on medication, including stimulants and non-stimulants. Shortly after receiving an ADHD diagnosis, Dr. Yair Bannett, an assistant professor of pediatrics at Stanford Medicine, stated, "We discovered that numerous young children are prescribed medications almost immediately after their ADHD diagnosis is documented. This is alarming since initiating ADHD treatment with a behavioral strategy is advantageous, significantly benefiting the child and their family. While daily medication alleviates symptoms temporarily, behavioral therapy equips families with skills and habits tailored to the child's brain function. Both methods are crucial for most children with ADHD to thrive. Yet, studies suggest that it's optimal to begin with 6 months of behavioral therapy before prescribing medication for preschoolers diagnosed at 4 or 5 years old. For children aged 6 and older, the recommendation is a combination of both treatments, as behavioral therapy imparts lifelong skills to the child and family," Bannett explained. Medication alone cannot achieve this, hence we never consider it the sole solution for ADHD. Bannett's apprehensions extend beyond the timing of medication. ADHD drugs tend to have more adverse effects on young patients due to their smaller body's inability to fully metabolize the substances. These side effects can manifest as heightened emotions and aggression in young children. We're not concerned about the toxicity of the medications for 4 and 5-year-olds, but we acknowledge that treatment failure is highly probable, as many families find the side effects outweigh the benefits, he added. The latest findings stem from an analysis of electronic medical records of young children with ADHD treated in 8 pediatric health networks across the U.S. Among over 712,000 children seen by doctors between 2016 and 2023, more than 9,700 received an ADHD diagnosis. Shockingly, 42.2% of these diagnosed children were prescribed medication within a month of their diagnosis. Even for preschoolers who didn't fully meet the diagnostic criteria, 22.9% were given medication within 30 days. Although the reasons behind these treatment decisions remain unclear, Bannett mentioned that lack of access to therapy emerged as a significant barrier in informal discussions. Physicians often share, "We lack resources to provide families with behavioral management training. So, evaluating the pros and cons, we believe medication is preferable to offering no treatment at all," he elaborated. Approximately 7 million children, aged 3 to 17, have been diagnosed with ADHD, as reported by the Centers for Disease Control and Prevention. Diagnosing ADHD involves no single definitive test, and symptoms can evolve over time. Before the age of 12, ADHD typically presents in 3 forms: inattentive, hyperactive impulsive, or a combination of both. Symptoms include difficulty organizing tasks, paying attention to details, following instructions, constant restlessness, excessive talking, and trouble remaining seated. The exact cause of ADHD remains elusive, but scientists suggest that genetics, environmental factors, head injuries, maternal mental health, and substance use during pregnancy may contribute to the risk.